The next really important thing to consider is your care. Now, sometimes this can be a difficult conversation or something that people don't really want to talk about, but it is something that has to be addressed. So next we're going to be talking all about your care. And I bet when I said that, you were thinking about your health care. Probably you're not retired yet. And your health care might come through your work. So one of the things that I invite you to think about is when you leave your work, when you actually retire, where is that health care going to come from? Because we've got to keep ourselves healthy to make it through retirement the way that we want to. Now, a lot of you have probably heard that you can use Medicare. That's true. Some of you have other plans, especially if you worked for the government. But all we have to do is make sure that you have a plan for care in place. Now let's skip forward just a little bit further out into retirement. There's another form of care that we often talk about at this stage of life, and that's long-term care. Now, I'm not only talking about going to a nursing home, but that could happen, and we need to make sure that in order for that to be smooth for us, we need to have a plan. That doesn't mean that you need long-term care insurance. It doesn't mean anything other than the fact that you have to have a plan of action that you can take for yourself if you're not able to care for yourself, especially being a woman. If you are married, 80% of us outlive our husbands. Yeah, that's 80%. So what does that mean? Well, if we have a retirement plan and he passes before us, guess who gets to experience whether the plan works or not? It's us ladies. So if we have a husband and he needs care, most of us will spend whatever we need to while he's here to help care for him. And then where does that leave us? Sometimes it leaves us devastated financially. Lots of times it'll leave us devastated emotionally. So the main thing we need to make sure of, ladies, is that we have to have a plan for your care.